So thank you for attending the first question and answer session for the Winnebago County Community Mental Health Board's program year 2022 grant application. A full list of funding resources can be found on the Winnebago County Mental Health Board's current webpage at www.r1planning.org/WCMHB. And we can share that in the chat. If Chelsea, if you wouldn't mind helping me out with that, thank you. And then everybody can link to that. If you have not already, you can see those resources. Pretty much every potential resource you would need for the grant application is linked there on that page under funding resources. If you have not already seen our board president, Mariana Abadi, Winnebago County Community Mental Health Board President. Mariana Abadi is with us today, and also Vice President Dick Kunert. And they will be able to assist me in answering, hopefully being able to answer all of your questions today, or anything we cannot answer today to get clarification on so that we can answer it for you at a future time. I will start with a few questions that I received through emails prior to today's meeting, and then we'll open it up for additional questions from those who are on the call today. First question was related to collaborative programming, and a question about how collaboration should handle filing grant applications. You will note on the budget template in the grant application, there is a place for subcontracting, and that certainly is appropriate for things like contracting, let's say a counselor or psychiatrist that works outside of a particular organization, or other types of small services that might be contracted for from outside of an agency. We would recommend that that line not be used for any expenses that are in excess of 10% of the total budget. And the reason for that is that the Mental Health Board has some very strict standards about how funding can be spent. And you can see all of that in the funding policy. And by putting large amounts of money into a subcontract line item, it does not allow for board members to see that those expenses are in alignment with the funding policy. So if you are collaborating, if there's multiple agencies collaborating on a particular program, an alternative to that, especially if some of the subawards will be more than 10% of the total budget, would be to create separate budgets for each agency in the same application, and then to combine those budgets into one document and upload those as the budget. So on each budget, it does allow for you to write the agency's name. You can, in the program narrative, explain that there's multiple agencies working on one project, and then complete a separate budget for each agency, which would show the detailed breakdown of revenue and expenses that that particular agency will receive and or expend for the program. That way there's accountability for every dollar spent by each agency involved. When there are more than one agency filing a collaborative application, it is the responsibility of the lead agency to provide fiscal and administrative responsibility and accountability for the grant. Sub-awardees, anyone collaborating, will still be responsible for maintaining alignment with the Mental Health Board strategic plan. So staying within the service areas that are noted in the priorities, staying true to the target populations, and making sure that they report outcomes consistent with the requirements of that particular program. So in the case that you want to do some type of collaboration, but there's no one particular agency that wants to take on the fiscal agency for others, you may alternatively file multiple applications and use the same project name, which would allow for the mental health board to understand that there's multiple agencies applying for funding for one particular type of collaboration. However, please note, if you choose to go this route, there is no guarantee that all of the agencies applying will be awarded. So this would not be recommended in a situation where one agency's ability to complete their part of the program is dependent on another agency being funded. So in the case that there are those types of dependencies, it would really be recommended that a collaborative application be filled out, one application for multiple agencies filling out separate budgets. On the grant application portal, there is a collaboration button at the top right-hand corner of the application portal, and that would allow, so whoever the lead agency is would fill out their organization's information, and then you could add collaborators from any collaborating organizations who you can give access to review, edit, and or submit the application. So you want to be careful what type of access you give based on what your intentions are. If you want somebody to co-write the grant with you, then you would give them editing access. If somebody, you want to give them the ability to submit the grant on behalf of the collaborative, you would give them the submission access. Before I move forward with additional questions, are there any questions about what I just explained? Okay, very good. Question number 2, related to capital expenses. I'm going to reference the budget document here as I go through this. You'll note on the first tab of the budget template, there are brief descriptions of each of the expense categories. There are 2 types of capital expenses categories in the budget template. One is commodities and one is direct equipment. If you are requesting any capital expenses in excess of $3,000 or in excess of your agency's capitalization level, which I'll explain a little bit more in a minute, you will need to provide a capitalization plan. Your agency must have a capitalization plan or policy. Essentially, what that means is capitalization is an accounting method in which an asset would be expensed over the useful life of that asset rather than being expensed in the period the cost incurred. So let's just take, for example, something like a vehicle. Okay, if a vehicle were part of a program proposal and the vehicle has an expected life of 10 years, the amount that vehicle, the expense needs to be spread out over the 10 years of that vehicle. The reason for that is after 1 year of funding, the agency could potentially sell that vehicle. And if public funds were used to purchase that cost up front and then the agency sold it, that would not be proper use of the funds. So a capitalization plan or policy generally outlines for an agency how they spread out the cost of an asset over its life, and generally will have a capitalization level. So let's say $1,500, for example. Any expenses over that amount will need to be capitalized. Any expenses under that amount will not be capitalized. The commodities line item in the budget template are for things that fall under your agency's capitalization level, and the direct equipment line item or category is for things that are over your agency's capitalization level. And that is where, for the direct equipment, where you'd need to only include the cost that per the capitalization plan should be shown as a cost in this particular year. Any specific questions about that are maybe more specific to your organization or a specific program proposal, you are welcome to reach out to info@mentalhealth.wincoil.us. And Chelsea, if you could please share that in the chat box, you can find that email link. Any questions about capitalization? Okay, very good. Lastly, somebody asked, if our organization doesn't apply this year, can we still apply next year? The answer to that is absolutely. There is nothing to restrict an agency from applying in future years because you didn't participate this year. And in fact, we anticipate that there will be more funding next year than there is this year because we have not yet received a full year of the sales tax. So while we have $8.8 million to allocate this year, in future years, it is expected that the sales tax will bring in up to $12 or $13 million a year. So we do anticipate a larger amount of that amount will be able to go to program proposals. Furthermore, there are two priority areas noted in the strategic plan which will not be funded this year, but will be open for funding next year. And that is priority number 5, client outreach and identification, and priority number 6, supportive housing. Okay, seeing some questions coming in the chat, and you are welcome to put your questions in the chat and we can answer them that way. So question coming in, do we have to create an account in the grant portal in order to view the grant application and the requirements, or do you have a checklist with details we can use? Do you have the templates? So that's a great question. And right now we have not posted the full application on the website, but if that's helpful for applicants, and I'm assuming that has been deemed helpful by this question being asked, that is something that we could post to the website, a PDF version of the application. But just to be clear, the Mental Health Board is not accepting paper applications. So the application still needs to be filled out in the grant portal, but if it's helpful to see the grant in preparation, for this, then that's fine. Any other questions?
I have a question. Can you hear me?
Yes, I can. Thank you.
Okay, thanks. So if your project or your proposal for year 1 is really part of a 3-year plan or a bigger project, for the initial application, from a strategy and information perspective, would you recommend that we explain in detail the long-term overarching, opposed to, because a year really isn't a long time, right? And it's going to take time to ramp up, collect outcomes, and then the year will be over. So is it important within the grant application to outline what our long-term goal is?
That's a great question. Thank you, Carol. And I think absolutely it would be beneficial to explain in the program narrative the long-term goals and strategies associated with a program. However, for the intended outcomes, while you may note some of the long-term outcomes, we would like to see some specific goals for the program year noted in the intent. Yeah, for year one. So because those will be tracked over the course of the year, so we certainly want to benchmark those against the goals that were noted in the program proposal. And with that question, I will state, and it was noted in the grant seekers meeting, it is certainly the intention of the Mental Health Board to maintain a community support system over a longer period of time, and the intention to continue funding for successful programs. But that is a year-to-year decision that will be made, and there are no guarantees for renewed funding for any particular program.
Is the tax, is that a year-to-year approval, or is that from here? Like what? Yeah. I couldn't find that information anywhere.
Yes, that's a year-to-year. So the amount that comes in yearly, and then that amount is approved by the county board into what amount can be appropriated to program proposals.
Okay.
Hi, this is Uma. I have a question on the budget. So if our proposal is like an expansion to existing services, right? And so on the budget template, do we have to detail all the existing revenue and the additional costs, so that way we explain what we need? I was just a little confused when I saw the budget template, which says state on the revenue side, all of the revenue, including funding. So that confused me.
Sure, great question. Thank you for asking. We're certainly not expecting that you need to report all of the revenue for your entire organization. But if you're expanding services, I would imagine that's consistent with an existing program. And so in that case, we would want to see the current revenue and current expenses for the program, and then the expenses, the amount of revenue that you're seeking from the Mental Health Board would be the amount that I guess you'd be using for the expansion of services.
Okay.
I think a good way to delineate that is if the expansions of services will have the same program director as the current services, then we'd consider that one program.
Possibly. We're not sure yet, but it's just the question that I have primarily, like we provide XYZ services, but we want to do more than that. So that is why we're probably seeking additional funding, because we want to do perhaps some capital, perhaps some commodities, some additional or training, or whatever it is that we want to define the scope of the project. Just wanted to make sure that we have the budget correctly. Said we've currently list all the existing revenue, then and whatever is the difference between the two of the expanded plus current services, correct?
Correct.
Thank you.
Hi, Jason. This is Sue from Stepping Stones.
Hi, Sue.
Hello there. One clarification on something I heard and then a question. Carol asked about the continuation of the tax. It does sunset at some point in the not super distant future. Isn't it like 5 or 6 years?
6 years.
6 years? Okay, that's what I was thinking, is right now there's a kind of an end point for when the tax will be collected. Then question-wise, I did not see anything kind of in the priorities related to social determinants of health. if they are related to somebody's mental health treatment, can they be built into the budget as well?
So, you know, maybe I might have Dick add on to this question, but really the goal was to build a community support program for Winnebago County. And so I think the community support program in many ways does address the social determinants of health. It's just not using the same framework as the social determinants of health. But you'll note in the priorities, you know, particularly looking at priority number 5 and 6, which will be funded next year for client identification and outreach. Transportation is one of the service areas under that priority, and looking at supportive housing. That is, you know, something that's generally considered part of the social determinants of health. But, you know, I don't know if you have a specific social determinant you're wanting to ask about, but I think some of those already kind of naturally fit within the community support framework. But, you know, if you look and read the strategic plan, we really prioritized the components of the community support system that were most important according to kind of the environmental scan research that was done, and also the community engagement that was done, much of whom was from, you know, feedback from consumers, people living, people and their families, individuals and families living with mental illness and serious substance abuse disorders, and understanding what they saw as the gaps and what they saw as most important to address.
Okay, thank you.
Any other questions? Okay, I will note one more thing, a question that had come up, and I did not mention when I was talking about collaborations. So for agencies that have not been in existence for 3 years, that is a requirement of lead applicants. That is not necessarily a requirement for secondary applicants, so long as the lead applicant is willing to take on the fiscal and administrative responsibility for the entire collaborative or for that program. Secondly, in terms of, there are a list of agencies that are disqualified from applying for funding this year because of affiliations, meaning that they have a board member who serves on the Winnebago County Mental Health Board who is either an employee or a board member of their organization. And that is restricted by state mandate and also by the board's bylaws. And so to be clear on that, that also restricts those organizations from being a collaborator or sub-applicant, sub-awardee. It restricts them from receiving funding. It does not restrict them from collaborating necessarily, so long as they do not receive any of the funding that's being requested from the Mental Health Board. And
This is Sue again. How about
yeah, go ahead,
collaborating with someone from outside of the county if we are the lead agency? Are we able to collaborate with somebody who does not have a primary office in Winnebago County, which was one of the criteria that I had noted?
So the criteria in the funding policy is, yes, if you do not have a primary office in Winnebago County, that you at least have a local advisory board that is within the local area. I think I may need to provide more clarification on that particular answer, Sue, but I'm wondering, do you have without giving, any details about your proposal, I'm wondering, is there a specific need that you see that's being addressed by that type of?
Yeah, I do. There's another agency that we do a lot of things with that provides some additional services that we don't do, that as we have talked, we believe we could build a robust program with them providing the part of the services, at least initially, until we gain expertise in that area.
Jason,
Yeah, Marianne?
this is something that my understanding is that they really have to have be located in Winnebago County because of who's supporting the tax. But we should get further clarification if you think so.
Because we would be the one applying, and we would be the one doing all of the fiduciary stuff. We would be the one doing the hiring. We would just be, collaborating with this other agency that does not have a local advisory board or a primary office in Winnebago County. Again, just looking to try to meet the primary needs or the primary target areas that have been identified.
Yeah,
So
thank you.
So the target populations would be residents of Winnebago County, correct?
Correct. And the program would be located here in Winnebago County.
Okay. All right. So you're using outside expertise to serve local clients.
Correct.
Okay. All right. I think there must be a way that we can make that work.
Yeah, I would say that I can't think of any reason. I'm not thinking offhand that would be restricted by the policies, but I think that we could look into that and make sure that we're providing you a clear answer, and certainly follow up with those who are on this call today, if not the broader network.
Okay. And then if you need any more clarification or specifics, I can share that individually as opposed to on here.
Thank you.
Yep. Thank you.
Jason, this is Uma again. If we had more questions while going through the budget, would the email address that you provided, info@mentalhealth.wincoil.us, be the area to send an email to, or is there any other source?
Yeah, please send your questions through email, and we'll try to get you the best answer that way. And then certainly we have another call scheduled in a week from now, and you're welcome to attend that, even if you've attended today, if you have additional questions.
Thank you.
Another question that was asked here that is on the chat. If a hospital wants to apply that has been in existence many years but just started a new mental health program, can the hospital apply to help with expansion of mental health services at the hospital? So, as long as, in terms of the strict requirements of the policy, there's nothing to restrict an organization that exists for more than 3 years, has been operating for more than 3 years, to expand services into mental health that maybe have not been pre-existing. But I will say that if you look at the application, it's somewhat rigorous in asking for credentialing and certifications and any existing agreements with state, federal, or private insurance companies as it relates to fee schedules for mental health, et cetera. So, I would say, those, in terms of being a competitive application, you'd really want to take into consideration all those factors. Okay. Any other questions? All right, very good. Well, thank you so much for your attendance today. And once again, this will not only be posted on the YouTube page, but there'll be another question information session 1 week from today at 10 o'clock a.m. So you're welcome to attend that. If you have another question that comes up after today's call, you're also welcome to send questions to the info@mentalhealth email address, and we will try to answer those in a timely fashion. And your links are there in the group chat, so please take a minute. I'll give you another minute to make sure you have those before we end the meeting today. Okay. Thank you.
Thank you. Thanks for your time.
Thank you.
So good seeing you.
Thank you.
Okay,
Thanks.
Thank all of you.
yeah. Yeah, Jason, good going.
Thank you.